Today, we will be increasing public knowledge of how adequate sleep and treatment of sleep disorders improve health, productivity, quality of life, safety on roads and in the workplace, and increase one's knowledge of sleep apnea symptoms. Here we are going to talk about the difference between a short sleep and a sufficient sleep. A short sleep is when someone sleeps 6 hours or less. They tend to be more grumpy and have less energy. Sufficient sleep is when someone gets 7 to 9 hours of sleep. They have more energy and are a lot more happy. In America, 70% of adults report that they obtain insufficient sleep at least one night a month. National data shows that poor sleep health is a common problem with 25% of U.S. adults reporting insufficient sleep or rest at least 15 out of every 30 days. Are you not getting enough sleep? Here is an image of the state's prevalence of short sleep duration among adults. As you can see, Kentucky is considered to have adults with short sleep duration. When not getting enough sleep, problems will arise. The risk factors for inadequate sleep can be modifiable and unmodifiable. Modifiable means you can change, for example, losing weight. Here are some modifiable risk factors for sleep apnea. Non-modifiable means you cannot change. People with chronic diseases listed here show non-modifiable risk factors for sleep apnea. Male versus female. Men are more likely to develop sleep apnea than women. Age. Middle-aged and older people have a higher risk of sleep apnea. Race/ethnicity. Asian, African Americans, and Hispanic Americans have shown to have more severe sleep apnea than Caucasian patients. People in less developed countries most likely have sleep apnea but never find out, whereas in America, you can be treated and find out how severe your disorder is. Here are some health conditions that would occur if your sleep apnea was not treated, like heart disease, stroke, and depression. The symptoms of sleep apnea are loud snoring, awakening with a dry mouth, morning headache, difficulty paying attention while awake, and irritability. Now, it's time to take action and make a plan. Pictured on the left is a commonly used machine for sleep apnea patients called the CPAP. To the right is a machine called the BPAP. Now you may be wondering, what's the difference? Well, the CPAP blows constant pressure while you breathe in, and the same amount of pressure while you blow out. The BPAP blows higher pressure while you breathe in and blows lower pressure so it's easier to exhale. The next picture are retainers. These retainers help keep your airway open during sleep. And the last picture is to show that eating healthier will benefit you. Listed below are some references for you if you are experiencing any discomfort during sleep, and underlined are the addresses of the sleep clinics.